Hello, my name's Aisha Kader, and I'm delighted to be joined today by Dr. Christoph Reffel from Inselspital, Bern University Hospital in Switzerland. He is a joint first author of the paper published in this issue of JACC Interventions titled Long-Term Outcomes in Moderate and Severe Aortic Stenosis According to the Extent of Cardiac Damage. Thank you, Christoph, for joining us and for your time today.
Hi, Esha, and thanks a lot for the invitation to discuss the paper.
Perfect. So let's talk a bit about the background. Why is it that cardiac damage is important in moderate to severe aortic stenosis? And what is the question that you set out to answer in this study?
Okay, yeah, thank you. So aortic stenosis is still the leading cause of mortality due to valvular heart disease in high-income countries. And several studies indicate that factors beyond the classical grading of a valve stenosis may contribute to the adverse prognosis of patients with aortic stenosis, shifting the focus from assessment of valvular hemodynamics in isolation to a more comprehensive assessment of global cardiac function. And the concept of cardiac damage, which was proposed by Généreux and colleagues some years ago, provides a staging system, a staging classification for the extent of cardiac damage, the extent of secondary cardiac damage, ranging from involvement of the left ventricle, so left ventricular dysfunction, to the atria, the atrioventricular valves, pulmonary hypertension, and ultimately RV failure. However, today there's limited data regarding the long-term impact of such a staging classification of cardiac damage in addition to the traditional grading of aortic valve stenosis. And so our aim is to investigate the impact of cardiac damage on long-term outcomes of patients with moderate or severe aortic stenosis.
That's perfect. Thank you for setting the stage in terms of a background and helping our viewers understand the concept of cardiac damage. So tell us a bit more about the methodology now. You, of course, pooled data from two registries. So how did you design the study and also its outcomes?
Yes, so as I said, it was a pool analysis of two prospective registries at our university hospital, including more than 600 patients with moderate or severe aortic stenosis at baseline, at inclusion. And patients were then classified according to the extent of cardiac damage. So either it was early cardiac damage, defined as the absence of secondary cardiac injury, or restricted to involvement of the left ventricle only, or then advanced cardiac damage involving all the other stuff like atrial or atrioventricular valve dysfunction, pulmonary hypertension, or right ventricular dysfunction. The median follow-up was 7.4 years. The median age of the population, approximately 80 years, and almost half of patients underwent aortic valve replacement during the follow-up period.
That's great. And in terms of the results, you obviously compared those with moderate versus severe with the extent of cardiac damage, and also the fact that they may or may not have received aortic valve replacement. So tell us about how all these results compared.
Okay, so I would say the highlight findings or the highlight results were twofold. So firstly, as expected, patients with a severe aortic stenosis had a impaired 10-year survival compared to patients with moderate aortic stenosis. But interestingly, in patients with moderate or severe aortic stenosis, advanced cardiac damage was a much stronger predictor of 10-year cardiovascular and all-cause mortality compared to the classical staging of aortic stenosis severity. So advanced cardiac damage almost doubled the risk of 10-year mortality. Just hazard ratio was 0.88, and 95% confidence intervals range from 0.35 to no, to 2.62. And in the multivariate regression model, advanced cardiac damage was the only factor which was significantly associated with an increased risk of 10-year mortality.
And in terms of how did this compare with those who received AVR versus conservative management?
Yes, very interesting. So that was the second major finding. And again, as expected in patients with severe aortic stenosis, aortic valve replacement was associated with an improved outcomes compared to conservative treatment. But here it's very interesting that this was also the case for patients with moderate aortic stenosis, but advanced cardiac damage. However, this was not a case in patients with moderate aortic stenosis and early cardiac damage, and that's the interesting point.
Exactly. It clearly shows that cardiac damage staging may be quite a powerful prognostic discriminator. So this is not something that's clearly addressed in terms of guidelines. It's not something that we generally classify patients in practice. What do you think the clinical impact of your study will be?
Yes, yeah, that's a very important point. And so I would say in patients with moderate aortic stenosis, the classification of cardiac damage may be as crucial as a traditional grading of aortic stenosis. And our data even suggests that timing of intervention should be influenced by integrating the extent of cardiac damage rather than valve gradients alone. And I would say such as a combined staging of aortic stenosis, including cardiac remodeling and downstream cardiac damage, may provide a much more accurate reflection of the biological disease severity rather than based on valve hemodynamics, so isolated valve hemodynamics. And as a consequence, we should see aortic valve stenosis as a continuous disease, a continuous process where prognosis is determined by an interplay between the valve disease, but also the downstream cardiac damage.
Perfect. Thank you very much, Christoph, for breaking down this important study and for walking us through its very interesting findings. This manuscript is published in the October 27th issue of JACC Cardiovascular Interventions. So to those listening, make sure you check it out. And thanks again for your time.
Thanks a lot, Aisha.